Hi, we are students from Mapua University taking Bio20-1. In this presentation, we will discuss the history and mechanisms of how microelectronics can be applied in solving problems in the human visual system. I am Mark Alec A. Arbeso of Group 4. First, I will discuss the history and developments for interfacing microelectronics and the human visual system. It was first discovered that electrical stimulation of visual pathways may be perceived as light or phosphenes in 1929 by the German neurologist Otfried Forster. He used electrodes to stimulate the visual cortex of the brain. In 1956, the first known proposal for a retinal prosthesis-type device was outlined by Thesiger in Melbourne, Australia. The first application of an implantable stimulator for vision restoration was developed by Dr. Brindley and Lewin in 1968. This experiment demonstrated the viability of creating visual percepts using direct electrical stimulation. It motivated the development of several other implantable devices for stimulation of the visual pathway, including retinal implants. However, research and design of such a device did not begin until the late 1980s, when two different groups, one in Boston, Massachusetts, and the other in the Raleigh-Durham, North Carolina area, began serious investigations. Subsequent research by Dr. Mark S. Humayun and colleagues revealed that phosphenes could be perceived by both normal and blind patients, and through electrical stimulation of the retina. However, threshold charge densities in several blind patients were significantly higher than that in a normal-sighted patient. Implants of the first retinal prosthesis began in 2002 with Phase 1 clinical trials for the Argus 1. 9 years later, next generation Argus 2 was approved for marketing in Europe. After successful implantation in about 30 patients, 2 years thereafter, in 2013, the Argus 2 became the first retinal prosthetic device to be approved by the FDA for late-stage retinitis pigmentosa. It is estimated that well over $100 million has been spent by sponsors of almost 20 research groups for the development of retinal prosthetic device in the US, UK, Germany, Japan, Korea, Australia, and China. Currently, ongoing projects for retinal implant includes Argus retinal prosthesis, microsystem-based visual prosthesis, implantable miniature telescope, Tübingen MPDA Project Alpha IMS, the Harvard.
I'm Elijah Teo A. Borromeo, and my topic is head injury that causes blindness. What is a head injury? A head injury is any sort of injury to your brain, skull, or scalp. This can range from a mild bump or bruises to an automatic brain injury. Common head injuries include concussion, skull fractures, and scalp wounds. The consequences and the treatment vary greatly depending on what caused your head injury and how severe it is. It can be hard to assess how serious a head injury just by looking. Some minor head injuries bleed a lot, while some major injuries don't bleed at all. It is important to treat all head injuries seriously and get them assessed by a doctor. What causes a head injury? In general, head injuries can be divided into two categories based on what causes them. They can either be head injuries due to blows to the head or head injuries due to shaking. So, head injuries caused by shaking are most common in infants and small children, but they can occur anytime you experience violent shaking. Head injuries caused by a blow to the head are usually associated with motor vehicle accidents, falls, physical assault, and sport-related accidents. What are major types of head injuries that can cause you blindness? Hematoma. A hematoma is a collection or clotting of blood outside the blood vessels. It can be very serious if a hematoma occurs in the brain. The clotting can cause pressure to build inside your skull, which can cause you to lose consciousness or result in permanent brain damage, and also can cause you blindness. Hemorrhage. A hemorrhage is uncontrolled bleeding. There can be bleeding in the space around your brain, which is subarachnoid hemorrhage, or bleeding within your brain tissue, which is an intracerebral hemorrhage. The severity of the intracerebral hemorrhage depends on how much bleeding there is, but over time, any amount of blood can cause pressure to build and cause the patient blindness. Cortical blindness is the total or partial loss of vision in a normal appearing eye caused by damage to the brain's occipital cortex. Cortical blindness can be acquired or congenital and may also be transient in certain instances. Acquired cortical blindness is most often caused by loss of blood flow to the occipital cortex from either unilateral or bilateral posterior cerebral artery blockage and by cardiac surgery. The most common cause of cortical blindness is ischemia to the occipital lobes caused by blockage to one or both of the posterior cerebral arteries. However, other conditions have also been known to cause acquired and transient cortical blindness, including head trauma to the occipital lobe of the brain and many more. This picture here shows that the brain is connected to our eye. This part of our head is very important. That's why if you have acquired some head injury in this part of our head, you must see the doctor. What are the symptoms of head injury? It is important to be aware of the symptoms to watch out for. Many symptoms of serious brain injury won't appear right away. You should always continue to monitor your symptoms for several days after you injure your head. Common symptoms of minor head injury include a headache, a lightheadedness, a spinning sensation, a mild confusion, nausea, temporary ringing of ears, and blurred vision.
Hi, my name is Francis Neil V. Sese, and my topic for today is glaucoma. So, what is glaucoma? Glaucoma is a group of eye disease that can lead to blindness by damaging your eye's optic nerve. The eye continuously produces a fluid called the aqueous that must drain from the eye to maintain healthy eye pressure. So, what are the causes of glaucoma? Glaucoma can occur if fluid is unable to drain from the eye properly, resulting in a build-up of fluid and pressure in the eye. This increase in pressure then damages the optic nerve, the nerve connecting the eye to the brain. It's often unclear why this happens, although there are certain of things that increase the risk of its happening, and in a few cases, underlying cause is identified. Symptoms of glaucoma. There are so many symptoms of glaucoma. First is the open-angle glaucoma. With open-angle glaucoma, there are no warning signs or obvious symptoms in the early stages. As the disease progresses, blind spots develop in your peripheral side vision. The second is the normal tension glaucoma. People with normal tension glaucoma have eye pressure that is within normal ranges, but shows signs of glaucoma. Glaucoma suspects. Some people have no signs of damage but have higher than normal eye pressure called ocular hypertension. These patients are considered glaucoma suspects and have a higher risk of eventually developing glaucoma. They should be carefully monitored by an ophthalmologist. So, how to prevent glaucoma or the medications of glaucoma? A stinging or itching sensation, red eyes or red skin around your eyes, changes in your pulse and heartbeat, changes in your energy level. Glaucoma medication can help you keep your vision, but they may also produce side effects, some eye drops. Glaucoma prevention. Get regular eye care, exercise safely, take prescribed eye drops regularly, wear eye protection. So that's all for my report about glaucoma.
One of those is the blurry vision. Second is trouble seeing at night. The third is seeing colors as faded. Increased sensitivity to glare, hollow surroundings lights, double vision in the affected eye. Those are the symptoms to know if you have one. And you need to consult your doctor immediately. What are the causes of cataract? One of the causes of cataract is smoking. It is a major problem that you really need to stop. The second one is the ultraviolet radiation. Ultraviolet radiation is where you send a radiation to your lens and it really damages your vision. The third one is risk factors of cataract. There are some risk factors of cataract. The first one is when you get older, the risks are there. Heavy alcohol use, smoking, obesity, high blood pressure, previous eye injuries. A family history of cataracts. You can really adopt it from your parents. And I'm going to discuss if there are some microelectronics device that will help you to cure your cataract. And based on my research, there is the laser that blasts cataracts in seconds. Instead of using the traditional way of curing the cataract. The laser that vaporizes cataracts in a fraction of a second is set revolutionary treatment of an eye condition that affects more than half of Britons over 65. There is a traditional way where the doctors use a blade and they cut the outer layer where the cataract lies. But now there is a new way, and it is the microelectronic device that will help you. The new procedure uses a computer-guided femtosecond laser to dissolve cataract eye with remarkable level precision and accuracy. So it is actually safe and sound to use. Surgery is completely bladeless, unlike the traditional way.
The next topic we are going to discuss is all about retinal detachment. First of all, what is a retina? The retina is a light-sensitive membrane located at the back of the eye. When light passes through your eye, the lens focuses on an image on your retina. Retinal detachment occurs when the retina separates from the back of the eye. This causes loss of vision that can be partial or total, depending on how much the retina is detached. When your retina becomes detached, its cells may be seriously deprived of oxygen. There's no pain associated with the retinal detachment, but there are usually symptoms before retina becomes detached. One of these symptoms are blurred vision. Another is partial vision loss, which makes it seem as if curtain has been pulled across your field of vision, with a dark shadowing effect. Sudden flashes of light that appears when looking to the side, suddenly seeing many floaters, which are small bits of debris that appear as black flecks or strings floating before your eye. Types and causes of retinal detachment. First type is the rhegmatogenous retinal detachment. It have a tear on your hole in the retina. This allows fluid from within your eye to slip through the opening and get behind your retina. The fluid separates the retina from the retinal pigment epithelium, which is the membrane that provides your retina with nourishment and oxygen, causing the retina to detach. This is the most common type of retinal detachment. The next one is the tractional retinal detachment. Occurs when the scar tissue on the retinal surface contracts and causes your retina to pull away from the back of your eye. Poorly controlled diabetes mellitus can lead to issue with your retinal vascular system, and this vascular can damage later head to scar tissue accumulation in your eye that could cause retinal detachment. This is the less common type of detachment that typically affects people with diabetes mellitus. Excuse me. The next topic is all about the exudative detachment. In the exudative detachment, there are no tears or breaks in your retina. And this type of retina can cause such as an inflammatory disorder causing fluid accumulation behind your retina, cancer behind your retina, and also Coats disease, which causes abnormal development in the blood vessels such that they are liquid proteins that build up behind your retina. Treating the retinal detachment. First of all is photocoagulation. If you have a hole or tear in your retina, but your retina is still detached, your doctor may perform a procedure called photocoagulation with a laser. The laser burns around the tear site, scarring affixes your retina to the back of the eye. The next treatment is the cryopexy, which is the freezing with intense cold. For this treatment, your doctor will apply a freezing probe outside of the eye, in the area over the retinal tear site, and the resulting scarring will help hold your retina in place. The next treatment is called the retinopexy. A third option is in pneumatic retinopexy to repair minor detachment. For this procedure, your doctor will put a gas bubble in the eye to help your retina move back, place up against the wall of your eye. Once your retina is back in place, your doctor will use a laser or freezing probe to seal the holes. Cerebral buckling. For more severe detachment, you'll need to have a eye surgery in a hospital. Your doctor may recommend cerebral buckling. This involves placing a band around the outside of the eye to push the wall of your eye to your retina, getting it back into place for proper healing. Cerebral buckling may be done in combination with virectomy. Cryopexy or retinopexy is performed during the cellular buckle procedure. This is the last, and that is the last treatment. Thank you for listening.
Peace!
Ganun.